Good afternoon, everyone. I'm Dr. Morgan Crossman. I'm the Executive Director of Building Bright Futures, and it's my honor to welcome you to the State of Vermont's Children Briefing. And as most of you know, Building Bright Futures is charged under state and federal statute as Vermont's Early Childhood State Advisory Council, which is the primary advisor to Vermont's governor, legislature, and our federal delegation on the well-being of children and families prenatal to age 8. This year, we're really excited to celebrate 12 years of the State of Vermont's Children, and this is our annual report focused on providing data to inform early childhood policy and decision-making in Vermont. This year, much of the data that appeared in previous editions, so those of you who have really been following along all of the different iterations of this report will notice that a lot of that data has transitioned and now lives in Vermont's Early Childhood Data Portal. Vermont's Early Childhood Data Portal, which is part of Vermont's Early Childhood Data and Policy Center. And what we're moving towards is allowing the report to really focus on the key findings and data, ensuring that all of that detailed up-to-date data that you're traditionally seeing in the report is remaining publicly available year-round and is as up-to-date as possible. So before we dive in today, I want to share a little bit about how we're going to spend today's time. So here's our agenda for the day. First, quick orientation to our new guiding document that's going to really focus all of our work together for the next 5 years, which is Vermont's Early Childhood Strategic Plan 2030. Next, we're going to hear about this year's State of Vermont's Children Report, as well as some key indicators that show us where and how children are doing right now, and what's going on for families across the state of Vermont over the past year. Then we're going to transition into a panel focused on supporting unhoused families, which is such an important and central issue to the strategic plan, focusing on basic needs, as well as this year's policy recommendations of the State Advisory Council Network. So really trying to ground both our recommendations, but also the vision and strategy for the next 5 years, grounded in the data in this report. And then at the end of today's session, we're going to have some questions and discussions for about 15 minutes at the end. And as a quick reminder, housekeeping, the recording, the slides, and the report will all be available on the Building Bright Futures website later this afternoon. And as you are listening today, we invite you to submit any questions and comments into the chat bar. So before we go any further, just a quick note about Building Bright Futures' role in the system. So our core statutory role is to be that advisor to the governor, the administration, and legislature on the early childhood system and kids and families. And so what you're seeing on this slide is 5 of those key roles and responsibilities that really serve all towards how we advise those decision makers. So today's briefing is a real example of how we try to do that in a grounded, practical way using data and lived experience. Our new strategic plan is the backbone for all of that work. It really is giving us that shared statewide direction, and it's keeping our advising focused on systems level progress, not the one-off fixes. So on this slide, what you're seeing is our role to convene all partners across the system and elevate family, community, and provider voices so that all of our guidance is reflecting what's actually happening on the ground, whether it's in direct service or for families themselves. We're also monitoring that system with data, both quantitative and qualitative, which includes all of our work under Act 76 monitoring and our data portal. So again, really making sure anything that we are guiding the administration and other decision makers on is grounded in evidence. We're also doing a ton of work behind the scenes to reach out and understand needs of communities and translate all of what we're hearing into emerging priorities and then formal policy recommendations that are really explicitly anchored in the strategic plan for 2030. I do want to spend a couple of minutes talking about the strategic plan and orienting this group, since all of our recs and the data are really a driving force behind this document. So at this core of the strategic plan is Vermont's shared statewide roadmap for early childhood. So this document is meant to be a plan of plans that's helping agencies, partners, advocacy partners, policymakers, anyone who is supporting or working with kids and families to have a common direction, instead of everybody working in a range of separate frameworks on behalf of kids and families and as a state. So over the last 2 years, we built this through a really robust mixed methods process, engaging deeply in communities. So over 200 Vermonters contributed to developing this document, whether it was through conversations, letters, day in the life exchanges, and really understanding both the qualitative input paired with statewide data and systems monitoring to understand what the vision and priorities were. We will make sure that you have a link to this most recent strategic plan as well throughout today's session. But this plan isn't just about an aspirational vision for 2030. It's really grounded in lived experience and data. And what we heard from families is both what's working, like our trusted community supports and partnerships, but also what's not, like housing instability and unaffordable childcare and experiences of discrimination. So, for us as a state advisory council, the way that we hope you all are using this plan is as the backbone and that vision and strategy to shape how we show up to guide decision makers over the course of the year. It's really the lens that we'll use to both interpret the data, to elevate emerging priorities and what's happening on the ground, and to shape annual policy recommendations so that we as a state are all rowing in the same direction on behalf of our youngest children and families. So in terms of the plan itself, I just want to do a very brief orientation to the 5 different goals. And these, again, are very systems level, lofty goals that are describing what we as a state are trying to build for kids and families by 2030. Goal 1 is about foundations. It's ensuring that families and children have their basic needs met, including housing, food, income, transportation. Because what we know is that the rest of the system and outcomes for kids cannot thrive unless those basic needs are met. Goal 2 is focusing on health and safety. And so, how do we make sure that our children are being raised in safe and healthy and healing environments that are promoting resilience? Goal 3 is about opportunity. So, making sure that all of our children and families can access high quality, inclusive opportunities for development and early learning. Goal 4 is a new goal in this year focused on the workforce. And so it's really, again, this intent around ensuring children are supported by a well-prepared, well-supported, equitably compensated early childhood workforce across every sector for kids and families. And then goal 5 is the system as a whole itself. It ensures that we are centering families in decision making and making sure that our system is coordinated, well-resourced, transparent, and data-driven. What you'll notice in looking at the 5 goals here is that they are intentionally broad, but also interconnected. It's not serving as a to-do list for any one agency, leader, partner in the system. It's a shared framework for how we as a whole collectively will judge the progress that we're making and the decisions that we're making each year to know whether or not we're making progress for kids and families. So it's really being used, especially at the state advisory council level, as this yardstick. So when we're looking at data, budgets, policy proposals, you can use this and ask yourself a simple question. Does this project, does this priority, does this law, does this program move us towards these 5 goals and this shared vision, and how? What's so exciting about this strategic plan is it's giving us that next 5-year vision and set of goals. But today, what we're going to transition to talking about is the data, which is what gives us the accountability. It's really showing us where Vermont stands in 2026. So as we're entering this new year, and how that starting point differs depending on where a child or a family lives in the state of Vermont. And really for us to think about what that means. How are we providing equitable access? How are we seeing differences in outcomes or what kids have access to based on where we live? And what does that mean for how we need to make policy and allocate resources? So as we move into this data section of the briefing, just a quick shout out and acknowledgement that data work and really strong data work takes so much time and partnership. And we really appreciate the expertise, the guidance, and the time that all of our partners across the system spend to help both develop the report, but also the data portal so that we can centralize this information for all of us as partners working within the system, but also for those decision makers. Lastly, quick gratitude and congratulations to my entire team for 12 years of building Vermont's capacity to prioritize data-driven decision-making in this arena. So happy 12 years of the State of Vermont's Children Report, and thank you all for joining us today. I'm going to transition it to Dora Levinson, our Research and Data Director.
Thanks so much, Morgan. So we've just heard about Vermont's new early childhood strategic plan. Now I'll share two of the ways that Morgan already mentioned about how we're updating the way we track progress and make early childhood data available and useful throughout the year to inform policy and programming. As Morgan mentioned, this year's State of Vermont's Children Report has a streamlined format. The printed report focuses on statewide and regional profiles. And we've moved additional data into Vermont's early childhood data portal so it stays current. Data comes out at different times throughout the year, and a static report limits our ability as a state to use the most high quality, up to date data. The report is a snapshot, and the portal is where the data stays up to date. We've prioritized regional profiles because while Vermont is small and there are similarities in many regions, there are also unique challenges and opportunities depending on where you live and work. What works in Burlington may not work in Bennington, and what families face in Newport is different than what families face in Newfane. So let's take a quick look at the 10 key indicators on these profiles. It's essential to know where children and families live and how populations are shifting. The downward trend of child population continues as a state overall with a 4.1% decrease in children under 10 since 2019. But this ranges from a 2.3% decline in Orleans and Northern Essex to a 7.9% decline in central Vermont. It's also important to know about the economic well-being of children and families. So we have included two indicators. This year, the measure of children living in poverty is available at the school district and supervisory union level and is based on students with household incomes at or below 185% of the federal poverty level. This is a common cutoff for benefit programs and was about $59,500 for a family of four. We see wider gaps in this with this more localized data, with the percent of students living in poverty ranging from 17% in Champlain Valley School District to 67% in Winooski School District. The second indicator for the cost of living is reflected in the annual family budget for two working adults and two children from the Economic Policy Institute, which we've paired with an updated child care financial assistance eligibility. This cost of living allows for a modest yet adequate standard of living. For a family of four, it ranges from $104,000 in Essex to $130,000 in Chittenden. And in Chittenden County, that translates to an hourly wage of about $31.37 for each full-time working adult. One of the key factors impacting the cost of living has been the cost of childcare. Under Act 76, Vermont's landmark child care bill, eligibility for the Child Care Financial Assistance Program increased to 575% of the federal poverty level. Along with many other changes that have been implemented over the past 30 months, these charts compare CCFAP enrollment by age between September 2023 and September 2025, before and after the increases in eligibility. For Vermont as a whole, there has been a 58% increase in the overall number of children enrolled in CCFAP and a remarkable 82% increase in infant enrollment. Due to these changes, along with the shift to a family share or copay, the cost of living decreased between 2024 and 2025 in all but two counties. We've also included data on full immunization coverage by age 2, meaning the Childhood 7 series. While there are differences across the state, immunization rates have remained stable since 2020. And it's important to note that Vermont has not changed the childhood vaccination schedule, and it remains in line with that of the American Academy of Pediatrics. Regional profiles in the state of Vermont's children have always included data on children under 9 in out-of-home protective custody. We're continuing to see a positive trend here. Across every region, the number of children has decreased since 2020, and overall, the number of children in out-of-home protective custody has decreased by 29% since 2020. There are several different indicators for counting the number of children experiencing housing insecurity. The annual point in time count includes the number of households with at least one child. We also have information on the number of students who meet the McKinney-Vento criteria for receiving homelessness support services. And there's data for children under 13 meeting the literally homeless definition who are receiving supports from coordinated entry. This last indicator is available at the regional level, and we see here the distribution of the 1,685 children receiving those services across Vermont. Outcomes, as measured by 3 assessments at the end of pre-K, the beginning of kindergarten, and at the end of 3rd grade, show a disconcerting trend. Each profile contains data on students for pre-K literacy, measured through the teaching strategies GOLD for 4-year-olds, kindergarten readiness, and 3rd grade reading. There is variation across school districts and supervisory unions, but the trend is clear and has been consistent. With the most recent data, 91% of Vermont 4-year-olds are meeting expectations for literacy. 85% of kindergartners are overall ready for kindergarten. But when we get to 3rd grade reading, only 48% of students are proficient or above. The same trend holds for math, falling from 86% in pre-K to 35% in 3rd grade. When we disaggregate 3rd grade assessments by student characteristics, we also see wide gaps in proficiency. For Vermont as a whole, only 35% of historically marginalized students score as proficient or above in literacy, compared to 66% of historically advantaged students. And only 24% of historically marginalized students score as proficient or above in math, compared to 52% of historically advantaged students. While this discrepancy is not unique to Vermont, it is unacceptable given the future implications of a student's ability to thrive and the diversity and health of our communities. As previously mentioned, we're leaning into Vermont's early childhood data portal as the primary way to share data and how we're making it accessible year-round. The portal brings together data from many state and community partners, and we work to make it accessible, timely, and easy to use. It's built so people can explore by topic or geography and download data sets when they need more detail for analysis or to create additional visualizations. From our main page at buildingbrightfutures.org, you can find the data portal in 2 ways, either by going to Vermont's Early Childhood Data and Policy Center or under our work. This is the page for the data portal. As you can see, there are 2 primary categories for searching, geography and topics. As we just learned, there are significant differences depending on where you live in the state. So it's important to be able to look at more local data when possible. We also know that the early childhood system is broad and contains many sectors and systems within. So we've organized indicators by topic area. The most prominent theme that came through our community conversations to inform the updated strategic plan was an inability to meet basic needs. We have indicators here about the cost of living, financial assistance, food security and nutrition, homelessness, and housing. So let's look at data for homeless students. Here you can see data on students under 9 eligible for McKinney-Vento services over time. If you were to hear that there were 626 students under 9 eligible for homelessness support services, you might have questions about what that means. Being able to see the trend and the steady increase from 168 in 2018 might hit differently or prompt questions about how and why. As always, it's important to hear from individuals with lived experience as service providers or recipients of services, and we'll be hearing more during our panel about McKinney-Vento services and what support actually looks like. For each chart, you can download the full data set for additional analysis and creation of visualizations. Some of these data sets are quite small and discrete, and others contain data across multiple years, geographies, and categories. We all know that a chart doesn't tell the full story. So by clicking on the title, there is a page with a short narrative description, the chart, the data source, and related indicators. This indicator itself comes to us directly from the Agency of Education, but for public data sources, you'll see a link here. The related indicators here are the number of children and families served by the Family Supportive Housing Program and the number of households with children from the annual point in time count of sheltered and unsheltered people experiencing homelessness. This standalone page also makes it easier to share specific indicators. We are always adding more to this data portal and adding it and updating it as new data is released. As a state, Vermont has committed to data and evidence-based decision-making. The State of Vermont's Children and Vermont's Early Childhood Data Portal provide high-quality, up-to-date data that can be used to meet that commitment. At the same time, it is essential to listen to those with lived experience and use qualitative data in times of change. To make informed decisions, policymakers and leaders must be in direct conversation with families most affected and integrate qualitative data into fiscal and policy deliberations. And with that reminder, let's move on to hear from our panel on the challenges, successes, and opportunities for supporting unhoused Vermont families.
Hi, everybody. I'm Michelle Kersey. I currently serve as the Vermont Early Childhood Fund Grants Manager at Building Bright Futures and will be transitioning to a new role as the Data and Policy Manager over the next month or so. So there's so much to explore when we're thinking about basic needs for families. Issues related to housing, food security, economic security, and transportation are complicated and interconnected. With our limited time today, we're going to focus on housing. So as you can see on this slide that Dora shared from the data portal, the rate of children under age 9 experiencing homelessness in Vermont has grown substantially since 2018. It went from 168 students to 626 in 2025, which is a 366% increase. You'll find that housing security is a common thread in Vermont's Early Childhood Strategic Plan for 2030, in the State of Vermont's Children Report, and in Building Bright Futures 2026 policy recommendations. So while housing insecurity and homelessness is an issue that Vermonters face regardless of age, it's important to recognize that there are long-lasting issues for young children that experience homelessness during key stages of development. Our panelists today will share experiences with homelessness as well as strategies to support unhoused families. I'm really excited to introduce our panelists today. We have with us Nick Connor, who is the Director of Student Engagement and Data at the Montpelier Roxbury Public Schools. We're also joined by Lisa Atwater, who is the Family Support Team Lead at the Winston Prouty Center for Child and Family Development in Brattleboro. And she is accompanied by Britnie Morgan, who's the parent of an almost 2-year-old in Brattleboro, as well as James Miller, who is the parent of a 2.5-year-old in Brattleboro. So Nick, why don't you start us off?
Yeah, thanks, Michelle, and good afternoon. I will try to be brief, as I would love to hear from Britnie and James and listen to their voice. So good afternoon, everybody. My name is Nick Connor. I'm Director of Student Engagement and Data at Montpelier Roxbury Public Schools. I am also a McKinney-Vento liaison for our district. We talked about McKinney-Vento a little bit earlier, but to be clear, McKinney-Vento is really the name of the legislation that ensures that we are supporting young people experiencing homelessness, young people who are unhoused, and really doing everything we can as schools to ensure stability for our students that may have some level of housing instability. And so in my role here in Montpelier, I get to do a couple of things. I have the opportunity to work alongside many of our families. I also get to work on a lot of things to do with data. And I'm really happy to be here with you all today to kind of really talk about how we merge the two and really lift up the experience of our students and families, and also talk about how does the data help us shape what we're doing about it. And So I always kind of want to start with sharing a bit about the young people and the families that I get to work alongside. And so I'll share a couple of stories of some of our students in Montpelier, and I've changed their names, but today we're going to talk about Sarah and Greg and Chris. And I always talk about Sarah when I get to speak in any setting. Sarah's a kid that I remember quite well. She was a student who I had just started in our school district. I was in charge of attendance. And this was a student who wasn't coming to school much. They were in first grade. They were coming in late a lot, and the school called me. They said, "Hey, Nick, this kid's not coming to school. We need some help. What do we do here?" And I was like, "No worries. I have a flow chart. I know exactly what to do." And so I would call the family, and we would send letters about attendance, and I'd wait at the school to try and meet with mom and get a better understanding of how we can help them. And this went on for about 2 months, and we never saw really anything kind of bounce back. We never saw Sarah start really coming to school more consistently, and I could never reach mom. And so I was like, okay, well, I'm just going to show up at the house and say hi. And I did. And mom poked her head out the window, and she was like, "Hey, who are you?" I was like, "I'm Nick. I'm here from the school." She's like, "Yeah, I know. I'll call you later. I'm up here with a baby." I was like, "Oh, okay." She didn't call me later. A couple days later, I kept working the phone. Finally, she picks up, and I said, I don't know why I said, "Can I walk with you tomorrow to school?" And she was like, "I could use the help." I didn't know what that meant. And so I showed up the next morning, and Sarah comes running out full speed ahead, runs right into me. It was like, "Let's go." I was like, "Cool, this is going to be a great walk. I'm going to talk about all the things with mom, and we're really going to turn this around. And I'm going to let mom know how important school is and really talk to her about what it means to be on time." Behind Sarah came a younger sibling who I didn't know. He came running out too, and I was like, "Oh, who's this?" Like, "It's my little brother." I was like, "Cool, we're all going to watch school together. Great." Behind little brother came another little sibling who had one of those backpacks with the leash, and mom was carrying that one and pushing a stroller with a new baby. And I was like, "Wow, okay, well, let's go. Let's walk to school." I'm still going to tell mom all the things I have to tell her from a school perspective of how important attendance is. Well, it was everything I could do, right, to keep us going in the same direction and keep the kids from running into the road and walking up the hill on a cold day in November. And so finally we get to school, and I'm thinking, this is awesome. The school's probably going to throw me a parade because I got this kid to school. This is great. And instead, when we walked in, our front office folks, who I love, and this would have been me the day before, looked at us and then looked at the clock, and we were 10 minutes late. And that was our greeting, was that we were 10 minutes late, and that was disappointing. I tell this story because when we are talking about working with families and students, whether there is housing instability or other things going on, we don't really understand the story behind what's happening. That journey from home to school might as well have been 10 miles. The effort that it was taking for that family to get to school was Herculean in ways that many of our families are not actually needing to work that hard. But yet this family was greeted with disappointment. This family was greeted with letters talking about truancy, saying the family, like, the student has an IEP, they aren't really caring about their services, and none of that could have been further from the truth. So I share this story from the context of, like, literally walking with the family was a way that helped us understand and shape our district policy. What I will add to this is that while I often share that component of the story, I also want to name, when I share that story, folks will often come to me and say, "Oh, how's Sarah? How's Sarah?" The reality is I don't know. A few months later, after we did a lot of work and we actually got a bus to be picking up at this house in ways that it wasn't able to before because of the logistics of being within a mile of school, they were evicted and went on to be in a motel. And they were in 3 or 4 different motels over the next 6 months. And so all of the work that young person had been doing, that family had been doing to build relationship connection in school, now is in a place where the mobility is so high that when you don't know where you're sleeping tomorrow night, how can we expect you to be in school every single day? This family was eventually, they eventually needed to be in a motel down in Bennington. And so at that point, that student unenrolled from our district. And I share that from the context of, with housing, that was tough. With housing, those pieces were really difficult for that young person to be able to get to school every day. Without housing, it's times 10, right? So there's two other students that I will share about. One of my students, we'll call him Greg. Greg is another student who was in second grade. He was a big kid, and he would like lumber down the hallway, and he was in first grade, and give you just whether you wanted or not, he'd give you a big hug, and then we'd have to have this talk about how we touch each other. But like he was just such a great, like, joyful kid. And he was a student who first came to us because he was living in a local motel with his mom and dad. And this family moved to 7 different hotels over the next year. They were often told with very little warning that they needed to be out into the next hotel. And that could be in another city over, that could be 2 towns over, but they had to pack all their stuff, get there. As a school for McKinney-Vento, it's our responsibility to ensure that that young person has school stability. So we were driving every day with Greg, getting him to and from school. And oftentimes it would be me who would be doing the driving because the mobility was such that we couldn't plan a bus or a taxi in some ways like some school districts do, because the mobility was such that it was always a different place. And it was not uncommon that on some weekends, I would take Greg to the Walmart parking lot where he would be living with his family that weekend. And Greg would just have this defeated look on his face when I dropped him off there for the weekend. And then I will have a teacher 2 weeks down the line come and talk to me and be like, yeah, Greg's reading is really fallen off. I'm like, that makes sense. Let's understand the context here of Greg. And so this is another example of how, like, from a school perspective, we really do try to do everything we can to find stability for our students and young people, despite the high mobility. The last student I'll share with you is student Chris. Chris started with us last year. He is in second grade. Last year, Chris was not able to access his classroom at all. It was not uncommon for Chris to be in a space, pull every book off the shelf, throw it across the class, turn over furniture. He had some really hard days last year, and every day he was with a one-on-one instructional assistant to support him navigate his day, but very rarely was he able to be in the classroom. During this time, Chris, they had to give up their family dog, who was like Chris's best friend, because some of the motels would not allow pets to be there. We had to transition how we did our meals program, because when families are staying in hotels, the only thing they had access to was a microwave. Every bit of food had to be microwavable. So we had to change how we're doing this work and delivering food to our families. Over the summer, this past summer, Chris and his mom got stable housing. They are in an apartment, and when I took Chris home the first day to his new apartment, he was begging me to come inside to show me that he had his very own room for the first time ever. It was beautiful. It was like awesome to see Chris light up. They had a full fridge. This year, Chris is in his class every single day. He has not had a single incident like we saw last year. The ability for this young person to know where he's sleeping tonight, for mom to be able to know exactly this is the permanency that we have and this is how we're going to move forward, has totally changed how Chris is able to show up in the classroom, how Chris is able to show up in school. And so I share these 3 stories from the place of, to go back to the start. Any of us who have the opportunity to work alongside families, any of us who are working on policy, any of us who are working on data, take a walk with your families. It is where you will see how you can make change. Lift up and center the voices of our families. They know better than we do. And so when you have an opportunity to walk with your family, I would just encourage you, take every chance you can to walk with that family. So Michelle, that's my piece. Those are the things that I wanted to share.
Nick, thanks so much for sharing those stories. And I really appreciate how you were able to make that connection between the housing and the transportation and the economic security and movement. And that if you don't know where you're sleeping, how are you going to focus on that day's expectations? Thank you for that. And so I'd love to turn it over to Lisa and Britnie and James to talk a little bit about their experiences and some of the things that are happening down at Winston Prouty. Lisa?
Great, thank you. So I think James is going to share his story first, and then Britnie will go.
Hi, everybody. I'm James Miller. I am the parent of a 2.5-year-old named Tobias Miller, and I have a wife named Carrie Brown. And our story, our descent into homelessness is an interesting experience. I won't be able to share every aspect of it due to time, and nobody really wants to. But it really is summed up with two things, and that is health problems and a loss of an income, loss of two incomes, actually. In 2022, my wife became pregnant with Tobias, and at this point, my wife and I had been together for 16 years. So he was a very late comer. We attempted to, have children very early on in our marriage, and we weren't successful at that, and we, had sort of given up, so to speak, and we said, okay, we're not going to have kids. We're going to be, childless people. And we learned to live with that. I have suffered from a lifelong mental health conditions as well as musculoskeletal conditions. And I've worked really hard throughout my life to overcome every obstacle that has been presented. I spent the first career I had, I was a cabinet maker, good at it. My health didn't allow me to continue that. So after 12 years of that, I transitioned into architectural design, which I've spent the last 16 years doing. Sometime last year, excuse me, around May, things had started to really worsen for my wife's end. Let me back up a little bit. When she was pregnant, she developed cardiomyopathy, which is a pretty serious heart condition, and she went into congestive heart failure. And Tobias was a month early, so that whole incident was stressful enough. She couldn't return back to work after giving birth, so it all kind of become my responsibility financially. And things were fine for about 2 years, and by the second year mark, her health started to decline, and we made the decision that we were going to relocate from Florida to Vermont to be with her sister and her brother who are here. And right around the time of trying to sell the house and, just the stress of everything, the move and all that, I started having some troubles, and I went into a manic episode. So I had to deal with that, and I was in and out of the hospital, and, I was supposed to be bringing work with me. I was supposed to be a remote worker doing architectural design. And when I couldn't keep up with things, both mentally and physically, my boss let me go, and that work never transitioned with me on the move. I was immediately homeless the moment we decided to move here. And I had the notion that that was going to be a situation. We attempted to get two places. Both of those places fell through for various reasons, particularly because we were out of state and I couldn't guarantee an income. I had no job lined up. Though I was attempting to line up work, I was still struggling with in and out of the hospital, so it was difficult to do interviews as well as just meet the demands of everything at home. So my wife moved in with her sister while I was in the hospital last June, dealing with my manic episode. And when I got out of the hospital, I took the last remaining $8,000 that we had after selling all of my belongings and moved our stuff up here. I immediately went into the woods with a tent and did my best to survive for about 20 days. My wife was still with her sister and my son, and I got connected with a team here through a local homeless shelter, and they got me connected to Winston Prouty for my son because I had concerns about his uprooting, and his move was very drastic, and though he's only 2, I wanted to sort of circumvent any issues that may have arisen from that. And of course he started showing what we felt were behavioral issues, and so we've been, Winston Prouty has been very pivotal in supporting him right from the start of me going into homelessness. And at some point in time, like there was conversation of the Winston Prouty shelter opening up, and we were able to get on that list, and we've been going through services and stuff. But I guess I want to summarize everything I'm saying with, there are things that I could have done to make things a little easier or circumvent things over here, but the truth of the matter is I, both my wife and I, have health conditions that we didn't expect, and we're doing the best we can with what we have. And, the entire support system here in Brattleboro has been very accommodating in terms of, trying to get me back on track and surgery and, all the parts and pieces to keep me intact. And Winston Prouty's services alone have been a huge impact on my family. It was very challenging when I learned that my son knew he was homeless. He understood that he didn't have a home. He understood he no longer had a bedroom of his own. And that conversation took place again last night, at bedtime. He said, he wants a big house with big ceilings and tall doors, is what he said, and I'm doing my best to get back to that place where I can provide him that home again. One thing I discovered when I was homeless for myself and in the woods is every day was a challenge just to keep clean and feed myself. And I'm also diabetic, so that adds a whole other aspect of difficultiness to survival. And just taking care of myself alone was a huge challenge, and trying to add my wife and my son to that for I'm losing my train of thought, but sum it up, I am grateful for the services that have been available through Winston Prouty, and they are doing their best to help house us now. We've got a case manager that we're working with for housing support, so hopefully we will be moving into a home soon. That's all I got.
Thanks, James. Alrighty, hello everybody. My name's Britnie Morgan. I am the mother of Asher, who is almost 2 years old, and our journey started a year ago on his birthday, March 25th. We ended up in Londonderry, Vermont, in the hotel voucher program. That unfortunately ended for us in August, and we became homeless. And I started working with Easter Seals, and I had a care coordinator. And she didn't really know what to do for me, and she worked out of Brattleboro, and she knew that new resources were coming about, and that if I had a shot, that I'd probably have a shot here. And so we got dropped off at a park at 10 o'clock at night and told good luck, unfortunately. And so I did what was best for my son, and I called the state on myself at that time. And so my son got the best care and stuff. I have an amazing relationship with the family now, and I absolutely love the family. Dealt with being in encampments, being homeless, being in tents once I came here. And then I was at Groundworks, which is another facility for homelessness. And was working with my team, and we found out that Winston Prouty just got $1 million grant and that they would be reopening, and I was really excited about those opportunities and what that might hold for me and my family. At that time, I was only doing weekly visits through Easter Seals with my son, getting about an hour of time with him and stuff. Once I got accepted into Winston Prouty, I got given back half time with him, so I spent Thursday through Mondays with him. And we've been offered some amazing supports. We're in early intervention because he's a NICU baby, and I was worried about his development. I'm looking into parents as teachers. It increases parent knowledge of early childhood development. Early detection of developmental delays increases the childhood school readiness and success. And I also work with the Family Supportive Housing case manager, and we do that weekly. And I feel like that's just an all around good way to, keep progression going and stuff. And Winston and Prouty has really given me all the tools that I need to really be successful. And with all of this given, I'm hoping that by March 25th, my son's second birthday, that I will have full custody back of him. That is my story.
Thank you both for sharing. That's amazing. I tear up every time I think of 4 months without your son, and the first night you got to sleep with him is here at the shelter.
Yeah, and then I will be getting full custody back of him most likely here too.
It's amazing.
And it's because of all the support and everything that this has given me for an opportunity. And I don't think if I have had this opportunity that I would have had this turnaround in a year. I think I would have been here a lot longer and my son would have suffered a lot more damage from this. I think we were going to be able to recover from only a year gone, and it's hard, but I think, again, with your guys' support and your guys' help and everything that Winston Prouty has done with their resources and stuff, it's really given me and Ashi a family.
Great, now I'm crying already. So as we just heard, homelessness happens for many reasons, and Britnie and James's story are so different. But the consistent theme is that every parent that's experiencing homelessness wants what's best for their children. All parents want to support every aspect of their child's growth and development. Parents want their kids to meet their developmental goals, and they want to be able to access services if and when their child needs additional support. All parents want their children to grow and reach their full potential, whatever that may be. Parents want their kids to be happy and healthy. We want our kids to explore the world around them, make connections, develop healthy relationships with their peers. Being homeless takes all that away from our children and their families. When we think of our needs, even our most basic needs like food and shelter, clothing, sleep, being homeless challenges even those basic needs. Having shelter as a homeless family can mean a hotel or sleeping outside, hopefully with a tent, but not really knowing from day to day where you'll be that night. Food, how as a homeless family can you store food? If you're camping, you have a cooler for milk and other, need to be cold items, but you're always worried about having enough ice to keep things fresh. Can you start a fire to cook? Do you have what you need to cook? Even in a hotel room, homeless families have no way of storing groceries. Even the small refrigerators some hotels offer will not hold enough food. So preparing meals is a challenge. There's no place to prep or prepare meals when you're camping. Shopping often means from day or 2 days and only buying what you can take with you, mostly prepared packaged foods. And that also means prepackaged foods high in sodium and fats. Sleep in a hotel with the doors opening and closing and lights turning on, off, people moving around throughout the night. It can be hard and broken up by the many number of outside influences. Camping is even more challenging. As a parent, you're always on high alert to make sure your children are safe. Being inside a tent, that is, if you're lucky enough to have a tent, adds a whole nother level of constant worry. Even trip to the laundromat to get clean clothing. It's expensive and challenging, but walking to the laundromat, you can only really carry as much as you can hold in one arm because your other hand has to be holding your child. So that either means frequent trips to the laundromat or wearing unclean clothes. And how do you get your kids to medical appointments? In a way, we're lucky to be able to use a Medicaid ride. But that really only works if you know where the van can pick you up. There's a limited number of times that you can miss a ride or even miss an appointment with your doctor. So let's face it, it's stressful enough as a parent, but being a parent experiencing homelessness has to be not only incredibly stressful, but exhausting. The uncertainty of your days and nights has to be overwhelming. Parents have to maneuver through the day, not knowing where they're going to be at night, always being ready to pack up what they can and leave what they can't, either the hotel or the campground. When that happens and your family has to move, what do you keep? And what do you pack and carry? Can you store food? Can you get to the grocery store to get more food? Can your children attend the same school? Can you get them to their child visits? Will you be able to maintain the friendships that they've already developed? And then there's the guilt of missing child appointments, not being able to get your kid to school or your child to daycare, which in turn means another day of missing school, adding another stressor. If your child misses too many days of school, we all know DCF is going to be called. Feeling guilty for your child missing their friends. The guilt parents feel from being homelessness has got to be unbearable. As parents, we want to make sure our kids get to school and needed appointments, but the cards are stacked against most homeless families. Living in a state of constant high alert takes its toll on parents. Even in the best of circumstances, children feed off the energy we as parents give off. Children experiencing homelessness feel this constant stress and uncertainty. Our hope with being at the Winston Prouty Family Shelter campus is to take some of those challenges away. We want to give parents the chance to reset and de-stress. Being able to meet the basic needs with dignity and respect. Taking the time to focus on themselves and their children. Using the energy that it would take just to get through a day of homelessness to try to find a stable and permanent home for your families. Our shelter offers a full kitchen, a smaller kitchenette, a dining area, a playroom, and a living room space, and each family has their own room. The shelter is fully furnished, so basic needs like sleep and food are met. You can prepare and prep meals, cooking and storing food. You are sleeping in the same place, being able to develop routines and structure in your child's days and nights. We have on-site laundry. Clean clothes can be done as easy as throwing in a load. We have access to public transportation. The bus comes to our campus 6 days a week, which is ensuring families to get to needed medical appointments, family activities, or even just the grocery store. Just a little background about our shelter. In March of 2024, Winston Prouty opened a family shelter in 2 of the former school dorms. The original shelter was funded by state money from the emergency housing project that was set up during the COVID-19 pandemic. The family shelter provided families experiencing homelessness the opportunity to join the Prouty campus, giving time to settle in, reset from the constant moving and that comes with homelessness. All the families in the shelter worked with a housing case manager. This also started working with many other programs here at Winston Prouty to move forward. We opened knowing it was going to be a short-term program and we needed to hit the ground running. The original shelter ended in June of 2025, but the impact was incredible. Winston Prouty Family Shelter supported 28 families. Some of these 28 families had been homeless for over 2 years. 2 years of hotel rooms when available, camping when the room was not available, sleeping out in all kinds of weather, all while trying to keep your kids safe, maintain medical appointments like child and dental visits, school or daycare, the constant fear of where your family would go next, where they would get food or clean clothes. I can only imagine the energy it takes to live with that constant stress for days, weeks, months, or years. The 28 families that came into the shelter that offered a safe environment for families with spaces for children to play inside and out. We had round-the-clock staff to support the whole Winston Prouty community. I am happy to say that 18 of these families went on to permanent affordable housing. Most of the families are still being supported with our family supportive housing program, maintaining their rent, their kids are attending school regularly, and maintaining the important medical appointments. In September of 2025, the opportunity came to reopen the shelter to an incredibly generous donation. We didn't hesitate. We had learned so much from the first shelter, what went well and what was challenging. After revamping the dorms from the office space back into a shelter, getting the dorms set up for families with a lot of community donations, we reopened in mid-November, using just one dorm instead of two. We have room for 9 families to stay this time. We are currently housing 5 families. That's 9 children from 3 weeks to 13 years old and 7 adults. We'll be able to add an additional 4 families in just a few weeks. These families can access wraparound services from Winston Prouty. These services include children's integrated services, early intervention for children from birth to 3 who may have developmental delays with their families, early childhood family mental health, providing mental health supports for the whole family, including behavior supports for families and in childcare settings. We have a nursing program that includes health checks during pregnancy and postpartum, specialized childcare to find high quality childcare and utilizing supports to cover the cost. Family support, a family support case manager can hone in on, focus on the family's goals, breaking these goals up into manageable steps. The Parents as Teachers program, which is an evidence-based initiative designed to support parents in their role as being their child's first teacher, focusing on child health, development, parent education, group connections like play groups and field trips, and support in accessing community resources. Our parent educator is currently offering a weekly play group for our shelter families. That's 90 minutes of a play group that offers free play, a craft project, a healthy snack, letting kids and their parents just enjoy some playtime creating together. Winston Prouty offers a supervised visit program to help non-custodial parents see their children in a safe, structured environment. Family supportive housing, this program offers case management, service coordination, and access to affordable housing options. It is designed to assist families who are chronically homeless or at an imminent risk of becoming homeless. Embedded in this program is financial planning and education and employment support. Winston Prouty is here to support every family with whatever goals they may be. Being homeless is tough, but not nearly as tough as these families who live with being homeless and all those challenges that come from it and continue to work hard and make every day the best they can for their children. The resiliency of these families is awe-inspiring, and I'm grateful for the opportunity to see them succeed in whatever they do. Thank you.
Thank you.
Lisa, James, and Brittany, thank you so much. I hope you can stay on for some questions and answers at the end. And I'll turn it over to Morgan.
Yeah, thank you so much, Lisa and Nick, for sharing the way the systems of service are coming together to support families and the way that you're thinking about supporting families in a really holistic way, which is different when we think about the different lens that we each bring. Right. So when I'm thinking about our system of services, we might come to it from a housing or an education lens, or how are we supporting kids with disabilities and special health care needs? How are we supporting this very concrete service that a family needs? And what I heard today from each of you was that every single day is bringing such intense challenges, and not just for a child or a family to access services, but for survival. for families who are experiencing homelessness. So again, Britnie and James, thank you so much for sharing your stories, because when folks walk away from a briefing like today, yes, it's important for them to know that we have a rise in children under the age of 9 experiencing homelessness, but do they truly understand what that means? And that it's actually not just about housing and homelessness for each of those families. It's about the additional wraparound community supports for children and families that are needed. I loved hearing Nick say, take a walk with families. It's actually about how we are caring for them. How are we coming into movement and connection and developing those relationships so we can truly understand those needs on behalf of families. So when we're coming out of today's space for our legislative leaders, for other decision makers, one of the key takeaways for me is the reason we prioritized basic needs in the strategic plan as the foundation for the system is because everything else is built on that. If a child or a family does not know where they are sleeping or whether or not they have food or the ability to get somewhere, they are not going to be able to show up ready to learn or ready to work and to be contributing in the same types of ways. So really deep appreciation for all of those of you who are working with kids and families and are actually tackling it very holistically. If you're in education, you are really trying to meet those basic needs of kids and mental and emotional health. So thank you. Before we close this afternoon, I just want to quickly thank our data partners again who have made all of this work possible, as well as our state agency and philanthropic partners who are continuing to invest in data-informed decision-making on behalf of kids and families, because it is so critical in this moment that we truly understand the needs and use that data and lived experience to identify where resources are needed and where we need to make policy or programmatic change. We know coming into this session that there's going to be really big trade-offs and difficult decisions that are going to impact families and educators and school boards and organizations across the system in Vermont. And how we're making those decisions on behalf of our Vermonters is just as important as what we decide. So really proud of the Building Bright Futures State Advisory Council network in that role of being an advisor and that trusted resource on children and families prenatal to age 8. So coming into this session or coming into this next year, really hoping and wanting to support your ability to use the statewide strategic plan for kids and families, so the Vermont Early Childhood Strategic Plan 2030, the State of Vermont's Children Report, as well as the data portal, as not just reference documents, but ways that you can use them to guide decision-making, track impact, and then really focus on our collective responsibility, which is to ensure that children and families are at the center of our decision-making and that we're grounded in that data, best practice, and lived experience. So thank you so much for being with us today and for your continued commitment to Vermont kids and families. That concludes today's briefing, and we invite you to stay on for a few minutes for the question answer section with our panelists.